So I want to welcome to the stage Dr. Ijeoma Nnodim Opara, who is a close friend of mine. We've been working together for many years now. I've had the pleasure of hosting her in Costa Rica as well, and we've been working on faculty workshops, actually, training faculty to be better global health educators. She is currently a double board certified assistant professor of internal medicine and pediatrics at Wayne State University School of Medicine, where she's also the associate director of the internal medicine pediatrics residency program and an attending physician at Wayne State University Physician Group. Ijeoma's bio is quite extensive. I invite everyone to go to the website and read all her bio. I'm going to go through some short snippets of it, but I do invite everyone to go to our website that will be posted right now on the chat and visit and get to know more about Dr. Nnodim Opara's work. She is an incredible, innovative educator. She's created amazing courses, tracks, even fellowships that combine critical reflection, community engagement, scholarship and research, and even advocacy to advance the different structural determinants of health and health disparities. She co-founded in Wayne State the Global Health Alliance, which is a multidisciplinary organization that creates a unified and regional a group of global health practitioners that advance global and urban health. She also created and co-founded and directs the Global Urban Health and Equity Curriculum, which is called GLUE, which is, again, an interprofessional comprehensive certificate, competence-based global health curriculum. Her academic interests are in health equity, justice, social and structural determinants of health, and interprofessional education. She has a long history of leadership in service to the African immigrants and African American communities, and co-founded Africans in Medicine, whose vision is to unite African medical professions to further the health interests of Africans living in the continent and in the diaspora. She's a committed activist. She serves in the Wayne County Medical Society Public Health Committee, as well as she serves with me at the Consortium of Universities Global Health, a competency subcommittee and network of academic advisors where she improves policy development and supports global health and international development. Ijeoma, welcome to the stage. Welcome to the Global Health Summit. It's a pleasure to have you here. Really excited to hear your keynote address.
Good morning. Good morning. Good morning. Can you hear me okay,
Ijeoma,
Carlos?
we're having issues with your audio.
Okay. You cannot hear me at all?
No.
Oh, Michael says he can hear fine.
I hear from the screen someone saying,
I can hear you fine.
Okay, so you can go. Apparently it's mine. Go ahead. You're good.
You sure?
You're good to go.
Okay. All right. All right. All right. So allow me to just take a moment. Old pirate, yes, they rabbi, sold I to the merchant ships. Minutes after they took I from the bottomless pit, but my hand was made strong by the hand of the Almighty. We forward in this generation triumphantly. Won't you help to sing these songs of freedom? 'Cause all I ever had, redemption song, redemption song. The courage to be free, cultivating a decolonizing imagination. Thank you, Dr. Ferron, for your outstanding comments. UMB leadership for inviting me on this beautiful summer evening to have this conversation. And thank you to everyone on this call to share this moment. I bring you Motown greetings from one of the greatest cities in North America, Detroit, Michigan. And I'm also representing my country of origin, one of the richest nations in the world, Nigeria, which is located in the richest continent on earth, Africa. There's a popular quote attributed to James Baldwin that states, "Not everything that is faced can be changed, but nothing can be changed until it has been faced." But there is more to that quote, which is not often mentioned, which states, "History is not the past, it is the present. We carry our history with us. We are our history. If we pretend otherwise, we literally are criminals." In global health education, as it currently exists, do we pretend that history is in the past? Do we pretend that we do not carry our history with us? Do we pretend that we are not our history? Are we criminals? Ndubweje, onye amaghị ebe ọ si kwalie, kosi bịa ruo ebe ọ nọ, agaghị ama koshi ejuo obo na-eje, Ijeoma. Life is a journey. She or he who does not know whence she or he comes from, how she or he arrived at her or his present location, will not know how to reach his or her destination. Travel well. In preparing for this talk, I found myself taking a mental stroll down memory lane to my own childhood in Benin City, Edo State, Nigeria. As I'm sure majority of you know, Nigeria, one of the products of that fateful Berlin Conference of 1884, where Europe surgically arrested the development of an entire continent and violently rearranged the trajectory of humanity, won her independence from England in 1960. She'll be 61 years old on October 1st of this year. I was born at University of Benin Teaching Hospital, Benin City, Edo State in none of your business, okay. To a physician, scientist, father, and child development specialist and educator mother, both Igbo, both survivors of the Biafran Civil War, which occurred between 1967 and 1970, a complex, bloody war influenced in no small part by British expatriates and United States policy and financial interests. Hating that feeling of powerlessness, my father, looking older than his age, signed up to fight at 15 years old. It is a miracle he survived to have my siblings and I. As the first daughter in an Igbo household, I have the title of Ada, Adawiri. That is my paternal hometown in Imo State. Adas are held in high esteem and naturalized as leaders in the family structure, as well as the community as a whole. Yet I did not speak Igbo, one of the most beautiful, expressive, expansive, complex, and delicious languages in the world, because I wasn't taught. My parents would speak glorious Igbo to each other, waxing poetic, prolific, and patriotic, but then turn around and speak English to us. So I got to understand Igbo by listening to them speak to each other and their friends, but I couldn't speak the language. Now, don't get me wrong, I learned all the cuss words and insults, okay? Because that was the only time my mother unleashed the full gravitas of her Igbo vocabulary on us, all right? But other than that, I was just limited to the dry, cold, restrictive, inflexible English language to communicate the fullness of my reality. This preference was reinforced in school, where indigenous languages referred to as vernacular were prohibited. And I learned that there were only 3 main ethnic groups in the most populous country in Africa and the 7th most populous country in the world. I didn't find out that we have more than 250 ethnicities in that country, all right? And that my continent is home to the greatest amount of human and biodiversity in the entire world, till I was a super full-grown adult with children of my own and situated outside the continent in the United States of America. In school back home, I was taught that there were 3 races of people: Caucasoid, Mongoloid, and Negroid, in that order. always in that order, always. Internalizing the natural hierarchy of humans, right? Our books, nursery rhymes, stories, references were white, European, and over time, progressively American, but white American, always, always. Movies, advertisements, and media embedded into our consciousness the ubiquity of whiteness and all that, that the people of that particular phenotype who were located in the cold places have contributed to the world and humanity. I knew nothing about what people that looked like me had given to the world, had done for the world, had created, innovated, achieved before the white man came to our shores. I knew nothing of pre-colonial Africa, that she was the birthplace, she is the birthplace of humanity, that she's the pioneer of arithmetic, mining, and had the oldest agricultural technologies, that she was home to complex social organizations and her countless natural resources essentially keep the world going, and that she developed Europe and that she developed America. Through the extractive and exploitative, continuous, ongoing process of imperialism, colonialism, and neocolonialism. I wasn't taught about the rampant violence and destruction that was the coming of the European, that white supremacy was, what white supremacy was and what global anti-Black racism was, and that they were codified in structures and systems throughout the world, informing all aspects of our geopolitical realities, be it economics, politics, culture, psychology, spirituality, education, language, the works. Like many of the educated middle class bourgeoisie, I had internalized the colonialism that besieged my country. And so it wasn't until my first encounter with truth, with history, that my journey into decolonization and towards liberation began. The truth was in a book written from the perspective of an exploited, titled The Interesting Narrative of the Life of Olaudah Equiano, an autobiography written by a formerly enslaved Igbo man who purchased his freedom in 1766 and helped to pass the British Slave Trade Act of 1807 that abolished slavery in Britain. And that book led to me reading Ngugi wa Thiong'o's Decolonizing the Mind, Frantz Fanon's The Wretched of the Earth, Black Skin, White Masks, and Towards the African Revolution, Chimamanda Ngozi Adichie's Americana, Isabel Wilkerson's Caste, Tehisi Coates' Between the World and Me, Wole Soyinka, Buchi Emecheta, Toni Morrison, Langston Hughes, Maya Angelou, Amiri Baraka, Martin Carter, Paulo Freire, Aimé Césaire, and the list goes on and on and on and on and on and on. Work that grabbed hold of my imagination, scrubbed it clean, and gently and kindly began the reconditioning. It is why today I'm Afro deep in activism and demanding for the elimination of structures of oppression, while building liberated systems where people of African descent can truly be free in their authentic selves, not performing. Where we can be safe, be valued, thrive, and prosper. It is why I founded Health Equity and Justice in Medicine and co-founded the Global and Urban Health Equity Program to begin to identify, disrupt, and dismantle systems of colonialism, white supremacy fallacies, and anti-Black racisms codified in medicine, medical education, community engagement, and policies. It is why I actively interrupt narratives that are deficit-based and strategies that are rooted in deficit narratives. Why those systems are interrupted to or designed, calling out the design of those systems to curate scarcity mindsets and systematically exploit, devalue, and exclude voices like mine, bodies like mine, spirits like mine. Because to do otherwise, to be otherwise, for me is unacceptable. To do otherwise, to be otherwise, for me is to be in bondage. So when we pretend that we do not carry our history with us, when we pretend that we are not our history, are we criminals? Emancipate yourself from mental slavery. None but ourselves can free our minds. Have no fear for atomic energy, 'cause none of them can stop at the time. How long shall they kill our prophets while we stand aside and look? Ooh, they say it's not a part of it. We got to fulfill the book. The courage to be free. Cultivating a decolonizing imagination. A decolonizing imagination. Decolonization is not an end. It is a means to an end. And that end is true liberation, where we can experience true self-determination, self-esteem, self-definition, self-expression in our own languages, where we are free without interference to define what development means for us, what prosperity means for us, what health means for us, where we get to dictate our own terms for trade, exchange, and engagement, terms that benefit our most vulnerable, terms that center our values, where we get to design our own structures, our own infrastructures. And so I invite you to reflect and begin the process of imagination as to what does home mean for you? What does it look like? What does it feel like? What does it taste like? What does it smell like? What does it sound like? Decolonization is the 2021 Chevy Volt cruising down the street heading home. And to go on this journey requires courage. The courage to imagine better, to imagine different. It's the courage to dream. It's the power of a dream. Because whatever is in reality is created twice. Once in our imagination, and secondly, in reality. There is power in imagination. It is literally where liberation begins. Because that is where oppression situates itself in order to draw power. The mutually reinforcing systems of oppression, whether it be colonialism, patriarchy, capitalism, ableism, white supremacy, anti-Blackness, xenophobia, homo and transphobia, all this begin and end in the imagination. The imagination sustains, supports, empowers. Imagination powers our actions, strategies, and innovations. Our potential and what is possible is only limited by our capacity to imagine and imagine different, which is then followed by our willingness to do different. A system functions as designed. We will keep getting the same results if we keep the same systems. It will need to be dismantled. To dismantle, we need to decolonize our minds. It starts in the imagination, which powers our willingness to then act, our willingness to be different. It takes courage to undo, unlearn, unbe, to deconstruct centuries of conditioning that has laid fortified internal structures of oppression, internalized structures of oppression, which we reproduce externally in our systems of education, housing, healthcare, public health, economies, justice system, etc., which in turn reinforce the internal oppressive structures, again, like a vicious cycle. And so we require courage to interrupt this cycle, a daring spirit of boldness that goes beyond challenging and dismantling, even abolishing the status quo, but builds the new tomorrow. It's not just what we're decolonizing or what we're anti-ing, but what are we building? We cannot talk about courage without talking about fear. Fear. And so I invite you this morning to ask yourself, what are you afraid of? Honestly, truly. Why are you afraid of it? Honestly, truly. Understanding that fear is a tool of oppression to maintain the status quo. I invite you to think about who told you to be afraid of it. Honestly, truly? And how is your fear cultivating, nurturing, and feeding internal and external systems of oppression through silence and inaction, through the belief that it's not your problem when it totally and completely is? How is your fear cultivating and nurturing internal and external systems of oppression through confusion and chaos, busy work, and manufactured scarcity? How is your fear externalizing internalized systems of oppression? White supremacy and mutually reinforcing intersectional systems of oppression thrives in anxiety, manufactured scarcity, and the normalization of fallacies and limiting beliefs. In many spaces, the word fear, F-E-A-R, is represented as an acronym, false evidence appearing real. Today, I invite you to choose instead a different acronym, face everything and rise. Courage is not the absence of fear. It is the willingness to persist in spite of it. It is the willingness to imagine in spite of it. It is the willingness to act in spite of it. And it is required to do the daily work of decolonizing and liberation building. And it is daily work within global health education, starting with asking questions and exploring where within your various institutional structures, practices, and norms do patterns of extraction and exploitation show up? Where is the ownership of these programs and these processes? And what does the financial structure look like? So for instance, in your pedagogies, are you teaching true history? And from whose perspective? Are you starting and locating the beginning of history with the introduction of whiteness? Are you going way to the pre-colonial era to discuss the ways in which the continent has stood the test of time? Are you framing your curriculum within a socio-political context? What are your frames of reference? Are they located in Europe and America or elsewhere? What do you consider knowledge or evidence? Do you engage in the hierarchy of quantitative over the qualitative? Are you teaching and perpetuating biological determinism and racial essentialism, which is essentially scientific racism? Are you talking about power? Are you naming systems of oppression? Are you bold to call out racism, white supremacy? Are you bold to sit inside discomfort and allow it to make you grow? In your processes, are you asking quite these sort of questions when it comes to the admissions of your students, the hiring and firing of faculty and staff and leadership? What does your leadership look like? What authority or power do they have? In your partnership, who is in the lead? Who owns the data and the outputs? Who determines the agenda? What do your paradigms and your praxis look like? What do your pay or compensation structure look like? What do your policies look like? What values do they reflect? What does your budget reflect in terms of your values? Throughout your institutional structures and in your day-to-day, what assumptions are you making? What language are you using? What is your frame of reference? Are you constantly grounding yourself within deficit-based versus asset-based approaches? Are you highlighting and centering stories of resistance, joy, creativity, and innovation? Or is it always about hunger and poverty and badness? What perspectives are being centered in your work and throughout your processes? This summit on decolonizing global health education is not just an opportunity to look without. It is an opportunity to look within, to find the courage to look within as an individual and as an organization. One cannot decolonize or liberate anything when one is still themselves colonized and bound. You must find the courage to ask questions of yourself. Am I willing to lean out? Am I willing to give power? Am I willing to sacrifice? Am I willing to lose, to be inconvenienced? How am I participating in, benefiting from, perpetuating, or reinforcing systems of oppression? And let me tell you, it's painful. It is hard. You will cry and you will ache. But if you think freedom is free, And liberation is cute. Well, I'm here to tell you, honey, it ain't. Colonialism is inherently violent and costly. So what do you think that means for the process of decolonization? The revolution is courageous. The revolution is liberating, and liberation. The revolution is you and me emancipating ourselves from mental slavery. Look, the revolution is each of you taking your time to listen to a fine Black woman on a Tuesday morning, eager to do your part, whether you are an institutional leader, educator, student, layperson, or just another human brother or sister listening in. And so I thank you for this moment. I thank you for your attention. My wish for all of us is that today will be a milestone for the University of Maryland, Baltimore, for each and every one on this call, and for the people not on this call who are waiting for us to show up courageously and apply a liberatory imagination to finally bring about the change our ancestors called for. Thank you. Dr. Farron, I pass on to you.
Dr. Nnodim Opara, that was, I'm speechless. I have goosebumps all over my skin. That was incredibly powerful, and just reading the chat, it's going off the charts. The chat is going crazy. People really want to hear more of your work, get to know you better. For the people that are listening, this was recorded and it will be uploaded so you can share it widely. I love every word you said. It was so powerful. Thank you also for bringing a little bit of Bob Marley into your work. The great song, Redemption Song, 1979 classic. I grew up listening to Bob Marley and I was quite a fan. I think listening now to his lyrics in your words really bring another meaning to this. So I really appreciate for adding that extra layer to my youth. Dr. Opara, we'll be able to speak more offline, and we really thank you for this amazing keynote. It's really set the bar really high to what we now have to do as an event, as a university, right? It's really charted and mapped our way forward and the ideas that need to guide this. We must fight fear. We must step up with courage. We must have hard conversations, look inwards to be better. Thank you, Dr. Opara. I really appreciate your time.
Thank you, sir. Thank you, my brother. Thank you, everyone. I know there was a conversation around question and answer, but I'm also looking at the time. And so out of respect of the schedule, I will stay on the chat. So if folks want to ask, and I will make myself available for anyone to follow up. I will put my contact information in the chat as well, but please feel free to use the chat to ask questions and follow up with me offline as well. Thank you so much.
Greatly inspirational. Thank you, Dr. Nnodim Opara. Oof, so after that, I think we all need a little stretch. I encourage you all